Well, the calendar, at least, if not always the weather, tells us that spring is upon us. Traditionally, spring is when we begin to see respiratory illnesses start to decline, and that's exactly what we're seeing in Ohio right now. The rates of COVID-19 and RSV have been declining dramatically in recent weeks. Last week, there were 2,719 COVID cases reported statewide. That was a 40% drop from what was reported just 2 weeks earlier. COVID hospitalizations and deaths have also been decreasing. Influenza activity is also beginning to decline in Ohio. The CDC last week downgraded Ohio's flu activity from very high to high. The number of flu-related outpatient visits dropped 23% last week, and the number of hospitalizations similarly dropped 24%. These are welcome signs, but we can't let our guard down, especially while flu rates are still high. It's very important to continue to practice common sense prevention steps, such as staying home if you feel sick. Then please avoid being around other people as much as possible until 24 hours after you're both fever-free and your symptoms are improving. COVID vaccination, of course, remains an important consideration. Last month, the CDC endorsed a recommendation from the agency's advisory committee that adults 65 and older should receive an additional updated dose of the COVID vaccine that became available in September, as long as it's been at least 4 months since someone has had their last shot or 3 months since they've had a COVID infection. It's important to think about this new, updated version of the vaccine that became available in September as truly a new vaccine. And an additional shot now will shore up protection for those 65 and older who are more vulnerable to COVID-19. So far, 11.3% of Ohioans, including about 34% of those who are 65 and older, have received this updated vaccine. Yesterday, Governor DeWine and his wife Fran got the updated COVID vaccine. They also got their tetanus, diphtheria, and pertussis vaccine updated, which really highlights the importance of staying up to date with all of our vaccines. Now, here is a short video clip of the governor from yesterday.
So Mike, you're going to feel and stick. Okay. Just like that. All done. All right.
We want to thank Governor DeWine and Mrs. DeWine for sharing their experience with us, and we hope it encourages more people to stay updated on all of their recommended vaccines. In the case of the COVID shot, this will ensure maximum protection against a virus that is still very much in circulation and is claiming the lives of dozens of Ohioans every week. The final virus I want to provide an update on today is measles. I talked about this disease last month, and I want to reinforce the message today because there have been sizable outbreaks overseas. Inevitably, in this global environment, that means cases have surfaced in the United States and in Ohio. We cannot think of ourselves as isolated from these international outbreaks. Last week, the CDC announced that the number of confirmed measles cases in the United States in 2024 is already 58, the same number that we recorded in the entirety of 2023. In Ohio, we now have had 5 confirmed cases, 2 each in Montgomery and Miami counties, and 1 in Richland County. It's very important for you and your loved ones to be up to date on all vaccines, including measles, mumps, and rubella, or the MMR vaccine, which is highly effective. I encourage everyone to talk to their healthcare provider about their vaccine status and what vaccines might be recommended for you.